We're ready. Okay. And we're on perfect timing. Okay. So I am going to do naval cupping here. And we have our fabulous model here. So the first thing I'm going to do is look at your tongue. Okay, so it's pale, it's puffy, it's tooth marked. Okay, great. She is pretty healthy. I'm going to have felt her pulses already, but what I'm doing in this demo, I'll just start with I'm going to touch her belly. And so I'm just going to move this up, and I'm feeling for cold. She has no cold, she's warm. And then just a little bit of organic coconut oil. People are always like, okay, no problem. There we go. Can I have another tissue right behind you? Thank you. And then don't forget, you need a little paper towel or something to wipe the grease off. And then I had warmed my coin up. I'm going to put this on top of her belly, and I'll say, I'm not going to burn you. Don't you worry. People are really nervous the first time, and you guys can practice on yourselves at home. This is something you can do at home, so practice on yourself and your loved ones before you get a pregnant lady on the table or something. So it's a little foofy, so I'm just going to like stuff it together so nothing happens. And then this isn't as warm as I would like it to be, so I'm just going to warm it with my hand for a minute, and then I'm going to touch it to her body. So let me know if the temperature is okay. Okay, thank you. And now I'm going to light it. And I might have to wait a second. So now it's all lit. I'm going over, suction up. And I don't know if that's really, it worked. It wasn't a tight suction. If you have the flame higher, it will suction harder, but it's on there. Like I can't pull it off, or I don't. So then I would shimmy her hips, and ta-da! Naval cupping. So then at the end, so like I said, I was taught this as a treatment of itself. I've done this so many different things. We had a patient go in preterm labor one year. It was January. We had a cold snap here in San Diego, 22 weeks pregnant with twins. And she was in preterm labor and came to us freezing cold. Belly, bum, everything so cold. So we saw her twice a week, naval cupping, moxa, like 30 minutes of moxa afterwards. Her labor stopped and she carried those twins to 40 weeks. So cool. So there's so many uses that we could use that for. So now when we're done, we're just going to put your finger underneath, and sometimes I'll even tell the patient if I'm going to leave the room and this is all they have, if it bothers you, if it's too tight, it often tightens up a little bit over time. How does it feel right now? It's okay? Okay. I don't think I got a huge suction. You'll see sometimes it will go way up. So I'm going to remove the cup now. So I'm just going to place my finger in. It pops right off. And then I'm palpating just to see. She had no cold to begin with, but for most of our patients, like I do this a lot for fertility. You know, the fertility patients coming in, I'm like, oh, tell me about your diet. Oh, I ate so healthy. I had a smoothie for breakfast and a salad for lunch. Oh my gosh, that's what they say in California. And then in Pennsylvania, they have yogurt and fruit for lunch or breakfast. So it's really interesting. Thank you. Okay, thank you. All right, so I would look at her tongue again. Oh, I forgot to do the perinatal pull-up thing, but that is something you could do, especially if they're dealing with infertility or postpartum, is when they really feel that the most.
And you tell them to just do a Kegel while you're doing it?
I would do it. I would have them do a Kegel before I put the cup on. Yeah.
And then after?
And then after the cup is removed, yes.
Would you also use this for something like hemorrhoids?
I've used it for everything. Really. Yeah, like when in doubt, naval cup.
Is there an active bleed as well?
Like if someone's menstruating?
Yeah.
It doesn't matter anytime, yeah. And so like, you know, cupping is removing excess. If someone is very chi deficient, maybe you cup less time. If you're uncomfortable or unsure of this, cup for 10 minutes the first time. You could gradually add it on, but what I've seen is that it's never as good as it was the first time. People are always like, oh my gosh, you rocked my world. So it's really nice when people come in super stressed out. They have 15 chief complaints. They have a million things going on. And you're just like, let's just put a naval cup on you and see what happens. I'll be back in 10 minutes. And she's usually like, ah. And so Heather did teach us that it was important to just do this, but I think in the United States, as acupuncturists, especially in San Diego with 10 acupuncturists on every corner, they're coming for acupuncture, they're gonna get acupuncture. So I do some ear points, I might do like a Japanese root treatment, something. And at least then they feel like they're getting, you know, and then if they're yang deficient or blood deficient, I will sometimes spend 20, 30 minutes moxing them so it can be a long time, like labor intensive, but.
Can we use a different oil, like castor oil?
You could, I mean, it's interesting because the oil that I use versus what I just used, that's sesame oil. So that is a lot more cloying than what I was used to, but I was like, ooh, this is good. I kind of liked it. And especially with hairy bellies, maybe having a more viscous oil would work. So you could use castor oil. Yes?
I'm guessing you would not do this like first term.
Yes.
Okay.
Prevention miscarriage. She's freezing cold. So I've done that a lot of times where they're cold. Yeah. So I've done this, like one of my videos on YouTube is a woman who's pregnant and didn't even know it, like at one of my last seminars. And we just did naval cupping and she was cold and then she told me a week or two later and I was like, okay, great, congratulations. So no, there's really no time that it's contraindicated. Yeah. Okay, so I'm gonna have you flip over, please. Thank you. Sure, go ahead.
Can we do without the tissue, but with the cotton ball?
You know, it's just different. And so that's not the way I was taught. And the coin, this is important. The coin serves as a barrier. So it will pull out the evil chi and it will keep the essential chi and the good chi in the body. But it's only pulling up what's pathogenic, what's toxic, the heat, the cold. Yes?
I was just going to say, I stumbled upon these like little jade pieces that I attempted to use for gua sha and it never really worked. And I've been using that in my clinic.
Oh, perfect.
It doesn't.
Oh, that's great. Yeah, and Grace was just showing she uses a shell or a stone. So I've seen people use coins from China, gold coins, whatever you have. It's great.
Would you be able to use like ginger, like you would do ginger moxa?
Yeah, you could try it.
Ginger.
Yeah. I was told, though, very specifically that if you're not using the coin or you're using a plastic cup, this is not the same thing. So, yeah. Okay? Okay. Yeah, that's okay. It's okay. It's okay. So, all right, this does take a couple minutes to light. So I'm just going to give it a minute. My gosh, every direction there's people to blow this. So cool. So this is really easy. You know, you don't really need training. It's moxa. You light a moxa stick and then you warm the area. I'll show you the way Heather taught me doing lines, but like I said, I do twirls. I find cold areas. I often find, GB30 is cold on them. I might do bladder 23, whatever is cold, whatever I find. Oh. So see how it's red? All around I know, doesn't it smell good? I love moxa. I'm gonna start moxing myself. Okay, so blow out my candle, and then could I have the rice, please? Thank you. Okay, perfect. All right, so I am going to move the clothing, and I'm gonna pull this down a little bit, okay? So you kind of do need to expose her coccyx so that you can go all the way to the end of the sacrum. And we are going, I'll usually start down low and I'll go up the spine. And then you'll do the lateral border of the sacrum and then the lines in between. And some people's sacrums are really narrow, some are a little bit wider, so you can feel initially to know the landscape that you're working with, but anything cold in this area is gonna be beneficial. So then I'm gonna just kind of do these lines. She's not cold at all, but a lot of times I'm working with women where I could just be here for a half hour with the moxa. And then anytime you warm an area, after you're done warming, I want you, like if you want to focus on this bottom layer first, warming that, and then you could scooch it up a little bit. And then when you're done with the area, you would put a heat lamp on it. But really, like sometimes I'll do this 1 to 3 minutes, just a little bit will make a difference, and it warms them up, feels really nice. If there's any cold, I'll find those areas and use it, but this is such a simple technique that is so beneficial to so many. And you could do this on men, you could do this on women as well, and that is moxosacral fan, naval cupping.
Do you feel comfortable teaching friends or a partner to do that for her?
I do. I teach partners all the time to do moxibustion at home, especially for natural promotional labor, because I have so many of those cases. So, and when she's really cold, you know, the baby's not going to come out. The cold contracts. It's holding her in. She needs to warm up. So we could have her take a bath or whatever, but lots of good things. So, any other questions? I'm gonna put this out. So go ahead, Revital.
Always follow the naval cupping with the warming of the sacral area.
It's like a thing, yeah. And it's 1 or 2 minutes if they're yin deficient. If they have any, you know, I would just do like 1 minute with her. Like that's plenty. But for our really cold patients, you could spend quite some time there. Yes.
And pregnant ladies will be sitting for the sacral, I'm guessing.
I will put them on their side sometimes, or one of my favorite things is to get them on like a stool. And if you have that adjustable table, it makes it a little easier because you can put the stool there and then their bellies between the stool, and you can put pillows and they can kind of, that's really nice, especially if they're kidney deficient, because that will open up the kidney area and just you can have more access to that area.
Deb, you don't use pregnancy bolster and pillows?
I don't like them. I don't think they're comfortable for most people. I had one in the beginning of my career, but it only fits when she's 6 months and she's about 165 pounds. Like, it was just terrible. I was stuffing pillows in, or they were too big, and it was, so I don't like them anymore. I do sidelying for everybody. Pretty much I have a huge body pillow, so I'll have them lay on the side where one leg is down and one leg is bent, so I can access the yang side on one and the yin on the other. Any other questions? Wow, all right, fabulous. Thank you guys. Thank you.